follow all your social norms, follow your, that is social distancing, hand wash, see that you take proper appointment in your clinic, see that you go to the closest clinic which is possible, so that you do not waste much time and you do not go too long to visit the doctor, okay, so that the minimum amount of time is spent in the public and you do not have much of exposure to the public, okay. So that is one about the immunization. So many of them ask me, is flu and pneumonia advised? I would say yes, it is advised, because these are two vaccines which are again given for pneumonia and flu, which are again the lung diseases. So these are the two diseases which can compromise your lung, and a compromised lung can have a problem again. Okay, then coming, I think that completes about the immunization. So go ahead, take your immunization. If anyone is interested in knowing more about immunization, I have my own social handles. I have 3 social handles on my Instagram, on my YouTube and my FB page, all with the same name, Dr. Poonam's Vlog. So DrPoonams VLOG, Dr. Poonam's Vlog. So on my YouTube handle, I've already done one video on corona pandemic and the regular vaccination in kids, in which I have explained completely about the vaccination that should be done. Coming to the newborn care in the COVID era, okay. So now many ladies have, okay, hi Gauri Shelke, I think there has been, okay, hello ma'am, this is okay, I think Asif here, Japanese encephalitis is common nowadays. Yes, it is common, and in Goa, since I am from Goa, we already have a vaccine which has to be given at 9 months to 1 year. Like, why I said 9 months? 9 months it is given in the government setup, 1 year we give it in the private setup, okay. So Japanese encephalitis is a must vaccine in Goa. In certain other parts of India, it is a optional vaccine, so you can opt for it, but I would say better go for it. It's not a very costly vaccine, okay. Now coming to the third thing, the newborn care during the immunization, okay. The newborn COVID, the newborns, now imagine there is a mother who has delivered, she is negative, baby is also negative, okay. So in this case, everything will go on like regular, like, you know, regularly how you breastfeed the baby and take care of the baby. Now the second example, wherein the mother is positive, COVID positive, and the baby is COVID negative. Now once the baby is delivered, within first 24 to 48 hours, their first test is done to check whether they are positive or negative. If they are, whether they are positive or negative, they are roomed in with the mother. That is, the baby remains with the mother whether the baby is positive or negative, provided baby is asymptomatic. Now what is meant by asymptomatic? That is, baby doesn't have any problem. It is just that the test is come positive. So here the mother is also positive and the baby is also positive. This is number one example. Here again the normal things will continue. They are going the mother is going to breastfeed the baby. That's it. Now here again the mask need not wear, okay. Now we go to the third set, wherein the baby is negative and the mother is positive. Now what do we do here, okay? Here also the baby and mother is going to stay together. Only thing, the mother is going to wear a mask covering the nose and the mouth, especially a surgical mask. A surgical mask is a 3-ply mask which we wear in the during OTs and also. I will just show you one here. Something which looks like this. This is a surgical mask, okay. So such mothers who have delivered a baby and our mother is positive and baby is negative, preferably wear a surgical mask. Again, the surgical mask should be properly worn. There is a metal piece here on top, so you're going to bend that, okay, after you wear it on your nose. So this will go on your ears and then this will be bent. So I will just wear it and show you. So this goes on here, this goes here, covers your full mouth, and then this you have to press, okay, so that it fits on your nose. So this way you are going to wear a surgical mask. This surgical mask you are going to what is that, to change after every 8 hours, and earlier if that mask gets dirty with your nose fluid or with your mouth fluid, okay, so you have to change it earlier. I think there is a question here. Ravindra Lad, doctor, please let me know about RT-PCR test after the nasal swab is done. Ravindra Lad, I did not get your question. What is meant by RT-PCR test after the nasal swab is done? I mean, can you just tell me in detail so that I can understand? Because RT-PCR is done for all the people whom we are suspecting this thing. What is that? Coronavirus. Okay, so one is the antigen testing, the other one is the RT-PCR testing. I did not understand your question, like after the nasal swab test is done. Okay. So you can just clear that doubt, I'll answer the question. So I told you the 3 examples in the newborn babies. Now coming to the pregnant woman. So someone asked me about she's pregnant and she is around 24-25 weeks, okay, and 24-25 weeks and she's pregnant. How do I go about? So these ladies who are pregnant for and around 24-25 weeks, so 24-25 weeks makes them around, say, 5.5 to 6 months pregnant, okay, they have to be quarantined for 17 days like a normal person who would be quarantined. During that time they have to manage their check their temperature, pulse and saturation. So this is about the home monitoring. Again, for the home monitoring I have done multiple videos which are on my Facebook page, okay. That is, so pregnant woman will undergo 17 days of quarantine, and if nothing happens she is back to normal, and once she completes the 17 days she has to be treated like a normal lady who will be delivering normally or whatever is planned for her. Next is the breastfeeding and COVID. I think I already answered it. You can breastfeed without any harm. Indian Academy of Pediatrics says that all the mothers who have delivered have to breastfeed their babies for first 6 months, whether it is COVID positive or negative, even during the pandemic, okay, because that is what is going to give the baby a lot of immunity against lot more diseases. Rajesh Srivastav, ma'am, is it necessary to take precautions while living together with a neonate if you have no symptoms? Rajesh Srivastav, is it that the person is positive who is staying with the baby? If in that case the person who is positive has to stay away from the newborn baby, or he has to anyways isolate himself. A person who is COVID positive and asymptomatic has to home isolate himself, okay. The next question of yours is it necessary to take precautions while living together with neonate? If you have no symptoms and if you are COVID negative, you don't have to be you do not have to take any precautions. But yes, if you are someone who is daily going out and in for job purpose, of course, then you are going to not come too close to the baby. See that you do not kiss the baby, and also that it is more protective for the baby, okay. Then we come to the next question. One child, okay. One more question that I had got is, this is a family of 4 people wherein the parents are working. That's why their children, 2 children, were usually being kept with the grandmother. So the grandmother turned positive, and following that, when they tested, of the 4 people, that is the mother, father and the children, 1 child tested positive, the other child and the mother and father were negative. So now the dilemma comes, how do you separate the baby? The babies are around 4.5 years. You cannot separate these babies together altogether, okay. So what you can do is this baby with one parent, either the mother or the father, is going to stay separate in a separate room which has a attached bathroom and a toilet, or in a separate flat, or in a separate area of the house which has a separate toilet and bathroom, because here the child cannot stay alone, okay. This child has to be monitored for fever, that is temperature, pulse and saturation on a daily basis 3 times a day. Now in case of kids, when you are checking this temperature, pulse and saturations in a asymptomatic kid, it would be better if you do it when the child is sleeping, because these children do not allow to put that pulse ox or the thermometer. I mean, very rarely, if they are very compassionate children, they will allow. On this also I have made a video on how to check temperature and pulse in kids, and I really got a very cooperative baby while doing that video. So he has nicely allowed me, a 7-month-old baby. If you want to see it, it's also on my all the social handles. You can see that, okay. So when one child is positive, one parent has to give up to it and has to stay with that baby. How to monitor the kids? I said I've already made the video, so please go and check that video. So basically, when the child is positive, you are going to I think, okay, Ravindra Lad has asked me a question. Nasal test come positive, so doctor told me to do RT-PCR test after 5 days. My question is it better to do RT-PCR? Yeah. So RT-PCR test is much more specific than the nasal swab. Okay. So RT-PCR test has to be done. Usually we advise somewhere at around 5 days to 7 days, because that is the peak where the viral load is maximum. That's why we will usually ask for 5 to 7 days for the RT-PCR test. I hope I answered that. Okay. Mesha Gaukar has asked me, hi Mesha, my husband has mild fever and body ache just for 1 day, and after second day loss of smell, but he was self-isolated and later he went to test after 8 days, which turned out negative. I was taking his care with all the precautions. Later he had no symptoms at all. Now after 15 days, can we go and get our children back, as they are not with us as baby by baby or crying? Please help. Okay, Mesha, now since his test was negative, okay, then yes, you can go ahead, okay, because it's just another 15 days I think are completed. So another 2 days are remaining. So if possible, complete those 2 days. If not, yes, since your test is negative, you can go ahead, okay. I think it is a question of you getting scared of infecting the baby under the pretest that, you know, the test may be positive, because I think you are not tested, okay. So another 2 days if you can pull on, it would be better, okay. If not, 15 days is also not a bad thing, bad duration. It's a very good duration of keeping away from the parents, from the children. I have to appreciate this effort of yours, that in spite of being negative, you have been very diligent and you have taken the proper step, okay. Now coming to next question, how to monitor. Yes, I was telling you about the monitoring. In the kids also you have to monitor 8 hours their temperature, pulse and saturation. Preferably monitor when they are sleeping, so that, you know, they are not fidgety, because the more they move, the pulse ox will not pick up the reading. While checking the pulse ox, always see that the pulp of the finger, that is this pulp of the finger, so any finger you can use, okay. Many of them ask me which finger to use. Any finger can be used, because all the fingers have the same blood coming from your own heart, which is a single heart, okay. So now this is your pulse ox. You have to put, now I'm using my index finger, you can use any finger, so you're going to use this index finger. Mesha Kaukar, I think I answered your question. If you're clear about the question, please say yes, okay. So you're going to take this finger, put it in here. Now can you see there is a sensor here? You're going to put it in here and then put it on, okay, then put it on. So this is the sensor, that red. You're going to put the finger, and then once you put it on, some numbers of this sort will flash. Now this will be same in kids and in adults. The saturation has to be more than 95. The pulse in adults has to be less than 100. The temperature has to be less than 100. The pulse in kids differs according to their age, okay. So now I don't know whether you can see, my pulse is 77 and my saturation is 99. I think I'm breathing a very nice air, okay. So this way you will see those numbers on the pulse ox. Many a times it takes some time for that pulse ox to pick up your heart rate and the saturation. So don't read within few seconds. Wait at least for 15 seconds to read your readings, okay. And pulse, this thing, what is your temperature? Temperature should be ideally taken with a digital thermometer. Now why we say digital thermometer? Because many a times, you know, kids just take this mercury thermometer, they just fling it, they just throw it, and it breaks, and if it breaks, it can have problem. That mercury which comes out is very, very poisonous, okay. Okay, so I think there is some more question. Yes, Rajesh Srivastav, ma'am, how long to stay away from kid patient after negative result for kids? Ma'am, how long stay away from COVID patient after negative result for kids? Okay, Rajesh Srivastava, are you saying, like, you know, like suppose I am the mother and I am positive, and I have tested positive, so how long do I stay away from my kids? If that is the question, then you have to stay away from kids for at least 17 days. Now when we say away from kids, it is away physically from kid. The mother can do video call, the mother can do regular call, the mother can speak with the kid at a distance, or a long distance, like, you know, from the window, but need not come close to the baby, okay. So I have had many parents wherein they have gone into depression, saying that I couldn't talk to the patient, my child, and when I told them yes, you can do video call, they were so happy, like, you know, that I can do video. I never imagined that I could do video call, okay. So sometimes things just slip off your mind. So be connected with the people on your phone. You need not meet them personally.